Hi, this is Dr. Byrne with High Point Spine and Joint Center. I wanted to make a quick video about your cervicogenic headaches, helping you understand more about your diagnosis, as well as what we can do in the office to help you and some things that you can do to help yourself at home. So, cervicogenic headaches are a very common type of headache. They're usually about 15 to 25% of all headaches that arise, and they usually come from problems within the neck, limited motion in some of the joints of your upper neck, especially, can lead to a painful cycle of stiffness, muscle tightness, and joint inflammation. That leads to some of the sensitivities that happen around the nerves at the base of the neck and can then create these headaches, these cervicogenic headaches. Um, they're usually characterized by pain that's more on one side than the other. They can be bilateral, but usually it'll be on one side or the other. And people say it kind of starts with like a ache or a stiffness at the base of their skull that seems to radiate up around behind their ears and kind of into their head, and sometimes even behind their eyes a little bit. Usually the pain is pretty continuous, although it can fluctuate in intensities. And there's usually some chronic stiffness or tenderness in the neck with it as well. It's often triggered by certain movements or certain postures. And it's more common in women than men by about 4 to 1. And some of these poor postures include like slouching or forward head posture that can lead to more prevalence of cervicogenic headaches. So what do we do in the office? Some of your treatment options, we usually use a combination of different things, but we usually start with some sort of joint manipulation or adjusting, where we're fully evaluating the movement within the neck and the base of the skull and making sure that the biomechanics of that junction are correct so that the joint is moving freely, the muscles are able then to relax, and we kind of interrupt some of that pain cycle and that cycle of spasm. We also use different modalities like myofascial release. Sometimes we'll use some sort of dry needling, which is where we stick a thin monofilament needle into the muscle. We run a little current through it. That current then fires that muscle, helps it to reset and relax, and that again can interrupt that cycle of pain and muscle spasm. We'll often give you some different exercises you can do, and those are things that you can do in our office depending on what it is, as well as some things that we can teach you to do at home. So as far as doing things at home, it's also just important that you eliminate some of these postural triggers. So making sure that your desk and your workspace is set up correctly. Trying to make sure that when you're on your phone or you're texting, that your posture is correct. Trying to watch how you sleep. There's different things that we can give you at home to think about so that you're not having these habitual patterns that then create or make you more susceptible to these cervicogenic headaches. Hydration is actually also a big thing with cervicogenic headaches. When you're dehydrated, it really increases your risk of getting one. So making sure that you have plenty of hydration throughout the day can be helpful with these headaches. So I hope you enjoyed this video. If you have any questions, call or text our office. We're happy to answer questions that way, and hope to see you at your next appointment. Thank you.